What inspired me to go into medicine was an uncle of mine who's an orthopedic surgeon. I did shadow him before I went into medicine, and while I was trying to make a decision, and I did see, patients' reactions when after they've had their surgery, somebody who now can walk after they've had issues with pain, and say, well, this is a happy patient, this is a rewarding experience. So patients always ask, when can I go back to work after surgery? And since we started doing robotic surgery, you can tell patients you can go back within 2 or 3 weeks compared to the 6 or 8 weeks that they used to do after open surgery. And that's significant for them, for their family members who are caring for them. The amount of pain they have after the surgery is minimal. There are other aspects of the robotic surgery, like blood loss and other surgery-related details that also help in the recovery. So robotic surgery was introduced in urology and in the medical field in 2001, and I was a resident at the time at the University of Iowa in training, and so I had the advantage of learning with my mentors the robotic surgery. And in 2005 I started my practice, and in 2010 I was co-director of the robotics program at the University of Iowa as well. I really enjoy seeing the patients in follow-ups and making sure they're doing well. Many patients, I see them once a year after their treatment to make sure they continue to do well. I can recall a patient of mine that I treated for prostate cancer, and since I moved, I don't see him on an annual basis as I would do for a patient here in Wichita, and he sends me a card. Every year he does a trip, and I get these postcards from all over the world telling me that he's thinking of me and he appreciates the treatment he had, and that means the world to me. The patients that get their care at the Kansas Spine and Specialty Hospital tell me they've had a great experience. They volunteer their feedback, and they tell me they have had compassionate nurses, very caring. They are very pleased with the care they get here. And I've had patients who have had one procedure here, and they need another procedure, and I ask them, where would you like to go? And they would say, Kansas Spine and Specialty Hospital. My name is Fadi, Joudi, and I work with Wichita Urology Group, and I practice at the Kansas Spine and Specialty Hospital.